Welcome once again to Breakfast Central. The World Health Organization has confirmed that healthcare-associated infections, also known as hospital infections, are affecting healthcare facilities in South Africa due to regular water shortages. Water restrictions have been imposed in some of the country's largest cities, and residents in other areas have been without a consistent supply of water for months. Healthcare facilities, unfortunately, have not been spared.
Changing rainfall patterns and an intensifying electricity crisis are worsening the situation as water treatment and distribution require the use of electricity. The World Health Organization estimates that 15 out of every 100 hospital patients in low and middle income countries such as South Africa will contract this infection, while the estimate in high income countries is 7 patients out of 100. Joining us now to give us more insight on this is a Principal Pathologist at the National Institute of Communicable Diseases, Professor Olga Perovic. She joins us from Johannesburg, South Africa. Good morning, and thank you very much for joining us.
Good morning, and thanks for having me.
The stats we've just shared, 15 out of 100 patients. Give us a clear picture of what the reality is like, of how the water cuts are affecting doctors as well as patients at the healthcare facilities in South Africa.
Yeah. So just to clarify, that percentage or estimate is relating to hospital-associated infection in the low and middle income countries in any conditions, regardless excess of or shortage of water supply. So that number, or the estimate, is being done based on data. And for South Africa, we have no official data. What is the HI or healthcare associated infection at the moment? We have also estimate. So when we done some survey, what we find that depending of the different hospital level, different wards, the most important and highly risk wards are, for example, neonatal unit. Now, when we translate that to the shortage of water, and that is what actually also excess situation, and we had those area in Eastern Cape, for example, they had a difficult time, and especially last year, they had difficulties with the healthcare facilities. Some of them need to streamline their services and to adjust. As you know, the WHO, UN, UNICEF, they hope that basic supply to countries of wash or water, sanitation, and hand washing are critical for transmission in community and hospital associated infection. So in a nutshell, situation at the moment is that it is under the concern. There are certain areas, though, in the country, as we know, with the climate change, that we have excessive rainfalls, and in that case, we also need to have a different understanding in which direction this may impact, and especially is it a hospital or community. But in a nutshell, we do have a understanding and critical situation that brings either excess with the shortage or with the high rainfall that we are having at the moment.
Or can you also share, more light on the types of infections we're speaking about? That of course you have noticed in the healthcare facilities in general, and what would maybe be expected, if the water situation continues this way.
So the hospital, by default, are the breeding source of certain, and I have to say, highly resistant organisms. The reason why this is happening is that duration of the hospital stay for the patient in a critical conditions, use of antimicrobial agent because the patients are prone for those infections. Then also desinfectant. Some of those organisms are resistant to any disinfectant that we use in a hospital. So all that, and the level of understanding is that organisms are developing resistance, and those organisms are critical for any patient admitted in a hospital. We are talking about, I just want to simplify and say, those organisms may be opportunistic for certain group of patients, but are critical for those with underlying conditions. So when we have a patient in the ICU, a patient on oncology treatment or immunosuppressive treatment, diabetic patient, those patients are at risk of getting those infections. So that is at the moment at the hospital setting in general. Obviously, in those excessive situations, they are enhancing the load and the possibility of transmission. So in the hospital, most important situation is to have infection prevention and control measures. So now the question is how this is going to apply in the water shortage. But that is something that we call it a backup plan with providing the alternative water supply, also the hand washing facilities, and also the controlling and the admission and in the hospital, and also trying to discharge patients and not to stay too long. We know that as long patients stay in the hospital is the higher possibility to develop those infections. And just to simplify, those infections that can also be, we call them oral fecal route transmission. So if there is no hand washing, the possibility of transmission of those infections are much higher. So those are all that can be carefully cater in a critical situation. Is it as it mentioned, and we are mentioning at the moment, with the shortage of water supply.
Let's talk about the way forward now. So we have a reality upon our hands, which is unfortunately a dangerous situation. We're having power cuts. Whilst we're struggling with the power cuts, we're struggling with the water shortage. How can hospitals in this regard work with the reality of what is to maintain infection control even during the season?
So, yeah, that is also something that need to come in the multilateral and multi-field communication. So I was also looking at Rainwater annual report where they convinced that they do supply quality assess water to population that they cater in South Africa. So they also mention in situation they need to provide alternative water supply, and such as water tank, and very importantly what they've been also channeling through is trying to provide a borehole for the certain facilities and as a backup plan. And that also boreholes water should be quality control to wherever it is supported. Is it supported to the population or community or hospital setting? So that is one of the measures that can be done. Also, at the hospital level, I mentioned already, infection prevention of controls are critical. That in this excess situation, obviously there is enhancement, and we know that at the moment in a healthcare facility there is also a shortage of personnel that need to carry on taking additional loads of commitment, and in that case, we probably also need to encourage and try to incapacitate those settings. And for example, last year was the Eastern Cape having huge issues with water supply.
Olga Petrovic, thank you so much for your time this morning. It's not a very bright picture, but of course, now that we are aware, I hope the South African government is also, aware of the things that need to be done to improve on the health and safety of both doctor and patient in South African hospitals. Thanks for joining us, and we look forward to speaking with you again.
Thank you. Thanks.
Absolutely.